We're back, season 3 of the Love, Health, Prosperity podcast. And as always, we want to ensure that we bring you, again, dynamic and quality information. We want you to learn also, not only to watch the video one time, but also on various occasions, because it's so interesting, especially when it comes to the mental health field. We want for people to really benefit from the information that we have to give. And of course, the people that come on to our show are people that are qualified, people that have done the research, people that have really prepared themselves to be able to deliver a dynamic information as it is, and also inform their clients when their clients go to them. So today, I don't want to spend too much time on the introduction, but our first invite today is a good friend of mine. And I met him at one of the clinics here. And we collaborated together with several projects, also with a few clients. And I learned a lot from him. And I think one of the best things about him is that he's always learning new techniques, and he knows how to work with clients. He knows how to connect with them. But not only does he know how to connect with them, I think one of the best things is that his clients are very comfortable with his techniques. So I learned a lot from him for sure. And today, he's going to talk to us about personality disorders. Ivan Torres, welcome back to the show, buddy. How are you?
Part 2, Judgment Day.
Judgment Day. Yeah. There you go. I like that.
Thank you so much. No, it's good to be back. Marcelo called me and I was like, I got all the good talent in here, so I have to call you back bottom of the barrel as king.
Yeah, no, not at all. On the contrary, I think people need to see more people like you, young, energetic, and knowledgeable. Because I'll be quite frank with you, sometimes when you see a very young therapist, you're a little skeptical. You're like, well, okay, there's a lot of things going on here. I'm sure they have a lot of knowledge, but when you're an older folk like myself,
yeah,
I like to ensure that I'm talking to somebody who's got a
you
wealth
don't consider
of experience.
yourself like on the young side?
Me?
Yeah.
No. Well, thank you for that. But no, I don't consider myself on the young side. I actually think I'm quite the veteran.
but look at your place and everything. It's so like modern, and I think it's more in touch with like not just like a modern audience, but like a cool modern audience.
Yeah, well, cool. Yeah, it's my upbringing. Thank you for that, Ivan. Because I think growing up with all the things that I saw, a lot of my buddies that dropped out of high school, a lot of them that got caught up on drugs and became addicts, things like that. Well, you saw a lot of that, and one of the things that just kept me out of all that was the theme of this whole thing. Grabbing my board and being able to just go out and go shred. That was good. And I know for you, for example, it's a soccer, because I see a lot of your posts.
Oh yeah. Actually, we got invited to Nationals 5v5 in Florida. Just wanted to brag.
Are you going to do that though? Are you going to make the trip?
It's like we're invited, but you still have to pay, right? But the team seems up for it and everything, so we're excited because it's like nice to be like ranked high. So
perfect. Yeah, that's good. That means you got skills. How's it been life as a dad for you?
It's really good. Getting adjusted. Kids are hard, but it's worth it. It's
a big challenge for you.
Yeah, I mean, I think it's on the one end, it's kind of like just letting it like kind of like going with your instincts and everything, not overthink it too much. On the other end, like not letting kind of like, am I doing things wrong? Kind of like get to you too much.
Overanalyze.
Yeah.
Over rationalizing.
Yeah, because like then they could get back to normal, and then it's like, oh, it was nothing. You were just overthinking. You like you said right now, right? You said client instead of what is it, like therapist? So I think I think it's also good not to put ourselves like up here always, because we're human beings.
Absolutely.
Yeah.
Yeah, no, we all make mistakes, and sometimes we're surprised by the connections that we make. Mm-hmm. But that's the beauty of working with the mind, right? You just never know what you're going to get, for sure.
Yeah, well, like I mentioned, like you had like Viviana here last time, and I was listening, and she mentioned about that kind of like trying to like not say no to your kids and everything, right? And I was thinking about that, and I was just laughing. I mean, I agree with it, but it's like, what do you do when your kid's like putting rocks in their mouths, and you kind of like, you have to be like, no.
Yes, sometimes having to set boundaries is a hard thing with our kids, right? Yeah. But today, personality disorders. Wow, what a topic, man. Mm-hmm. And it affects, obviously, this border town.
Yes.
clients that we used to work with. Very difficult sometimes to be able to read and merge into their lifestyles, and because of the sudden changes in what's happening, and particularly because there's a bunch of personality disorders. But I wanted to focus on the ones that are more popular, I want to say, with people, more interesting. Some people see these as fascinating, especially Hollywood and Netflix and all that, because they make TV reality shows based on them and movies. American Psycho, for example, right? You've seen that movie before?
Yes, I did. And there's a lot of like interesting stuff about that movie. Like real quick, like I really find it interesting that like it's supposed to be like all in his head, that he thinks he's this cool guy that comes off a certain way. But if you analyze the characters, no one really likes him. Like he's like he's intolerable.
Yeah.
Right? And so like
he doesn't even like himself, I don't think.
Yeah, and so like, and I think that I think American Psycho is like more along the lines a little bit, well, not the like the actual killing, right? But like the perception. I think that's a little bit more spot on. I mean, for the era, it's kind of like still. I mean, it's probably not aged well, but like but compared to other things like Netflix stuff or whatever, I think that's a little bit over the top. I don't think that's very accurate.
So pop culture refers it as to being a psychopath. In the mental health field, what do we call that?
Well, I would say kind of like we tend to, and I don't know if that's where you're headed, but I think we always kind of go like borderline.
Borderline.
Yeah.
Okay. Yeah. But, well, that's one of them, definitely. Yeah. But one of the things that I was kind of amazed with was the change in the name, because we don't follow it in that way. Antisocial personality disorder.
Yeah, well, that's true. You make a good point, because like I think that a lot of people say like, oh, he's antisocial. It's like, no, like that, like being isolated is not antisocial. It's kind of like
that's what a lot of people think. I think a lot of times it's like, all right, so somebody who's antisocial is somebody who doesn't like to be out and about, doesn't like to make social connections, things like that. But in personality disorders, it's a little different, huh?
Yeah, it's much different. Yeah. And so we do have a lot of cases. I think when you and I worked together, that was much more common, the type of population we had. And that made it a little bit more difficult. I think that I was very grateful of people like you, because like you get a lot of insight about like, because as a therapist, at least back then, in that office, like, you get their version of things, which is fine. I'm not saying it's inaccurate, but it's also their perception, right? And then you come along and tell me like, yeah, Ivan, but actually let me tell you about like the dynamic with the family and things like that. And it's like that kind of like would make things a lot different in the approach.
Game changer, huh?
Game changer. Yeah.
What a big game changer though, because when you actually when you do those home visits and they're kind enough, first of all, to let you in their house, you start to see a lot of things, obviously, and that is what we have to report back to the therapist and ensure that they know what's going on exactly, right? And sometimes that could be a little difficult, because when you see all those type of things, you have to kind of piece them together like a puzzle, and then you guys have to make very
heads or tails,
difficult decisions and diagnoses. Do you feel that a lot of people are misdiagnosed?
I feel that, yes. I mean, I feel like a lot of people really own their diagnoses. I mean, and not so much, yes, they are diagnosed a lot, but I feel like a lot of people also like, oh, I'm this. And then they kind of like say like my bipolar, my this. And it's kind of like, why are you like...
They own it.
Right? Yeah.
They put the title on themselves.
Yes. And then that could shift, like that could be sometimes the indicator, one of the indicators of personality disorders, right? Because it's kind of like, it goes into their day-to-day. They're kind of like comparing obsessive compulsive disorder to obsessive compulsive personality disorder, where it's like it mixes into like their personality, right? What they do, how their regimen is, and things like that. And so sometimes I feel like when they own it, like, and it's not always, but like it could be indicative of a personality disorder.
Yeah, and totally different thing, right? From obsessive compulsive disorder to obsessive compulsive disorder personality disorder. Those are two different monsters also, right? Along the same
they can be still confused. I could probably still confuse them if I don't like stay up to date. And so yeah, you have to look at the little things. While they're very different, we can still kind of like misdiagnose. meaning well, but also I think that there are some cases where people are just like, here you go, bipolar, bipolar, bipolar. It's like, I don't think that's the case. Bipolar is really scary. I think a lot of people think they have it and they really don't.
Why would people think they have it though?
Because I think that they think it's a lot of like the constant shift, like, you know, mood swings. And I told them, no, I mean, it's part of, but it's more like, you know, you have a long, you know, the weeks of manic phase and the weeks of depression and things like that, right?
Yeah.
The manic phase where you kind of like do all these crazy things and then, you know, you have something to regret when you're depressed.
Well, what's happening in the manic phase that you see often here in the
The
border
risky
city?
behaviors, I mean, I think that it depends. Like, I think we got little bit more of that when you and I worked together, where, you know, your client could be kind of like doing well and suddenly like they disappear on you for like a month, and, you know, either they did partake in risky behaviors or just kind of like have been like their energy has been totally focused on different things.
Mm-hmm.
And they come back and they mean well and everything, but then that's where it gets tricky for us, right? Like, you know, you have to know, because you also have to, you know, make a living, right? And it's like, you know, do we continue working with the client? Do we refer them out and things like that?
That's tough.
And yeah, I mean, I think most of the time we kind of like work with it, but sometimes we have to know when to set those boundaries.
Boundary setting is definitely a challenge sometimes when it comes to this stuff.
Mm-hmm.
So, borderline personality disorder, BPD.
Mm-hmm.
What's that all about?
You know, I was just reading up on that, and I feel like, you know, even, you know, because like you told me about this, and like, you know what, I don't want to say something that you know, because I think that with personality disorders, to start off, I think you can really feel it, right? Like once you kind of like start talking to someone and it's been like not like a few minutes, but like, you know, at least like at the end of the first session or meeting.
How do you feel it?
I feel like, you know, the energy gets a little bit sucked out of the room depending on the personality disorder, right? Where it's like, where I don't see sometimes an interest in change. I think there's an interest in kind of like, I'm hurt because he or she did this and my father did that and all these things, right?
Lack of accountability.
Yeah, I mean, and I don't say like accountability, but like taking responsibility for like where you're at, right? And because like I think that I don't think that you're like responsible for the things that had happened to you, but like you are responsible for everything that, you know, happens afterwards. Not to sound like Will Smith or anything, but like,
Yeah.
that like, and yeah, and I think that that a lot of people, especially with the personality disorder, a personality disorder will be kind of like still angry, resentful, or pushing away from people that sometimes they do want to help, or sometimes they're just like, you know, too traumatized, right? But I think that's I would say that's the main difference with that and mood disorders. With mood disorders, I feel like I'm not saying that they're like ready to take responsibility, but I feel like it's not like they absorb a lot of that stuff and they think that something's wrong with them and they need to fix something, right? Personality disorders, I feel like it's a lot of pushing back into it's because of you that this happened to me, or I'm going through this and things like that.
In your experience, is that why it's so difficult to diagnose also?
And I think for treating, yes. I don't know about diagnosing. I mean, diagnosing, it's tricky because you want to kind of make sure that you're diagnosing correctly. But, you know, sometimes it just depends, right? Because like you have to put in something right away and they'll say, well, don't worry, you can always like modify. But like sometimes they don't come back or they only like come in for a few sessions and all that. You know what I mean?
Yes. And it's a little tricky with that one also because I mean, reading up on these books, for example, I Hate You, Don't Leave Me is a book that's very popular with borderline personality disorder. Also another one called Stop Walking on Eggshells by Randy Krieger, that's her name. And she goes into specifics about people who are diagnosed with different stages of BPD.
Yes.
But they call them like energy vampires. You don't know where they're at sometimes. Sometimes it's hard to talk to them. Sometimes even the therapist in the book, it's written that it almost kind of looks like she's the patient is psychic because they're kind of reading. They kind of look like they're reading my own mind and they're reading my body and they're looking at the words that I'm using also. So it's a little hard to kind of just have a really neutral face and have a session because it always seems as if they're on the defense. What's your experience been?
I think that yes, I mean some of them can be. I feel like we talked about this last time, right? Like some of them can be very informed. They've done a lot of like therapy before, or they're informed about psychology. And I remember someone even kind of like seeing my pupils dilate and stuff like that. And I feel like,
Really?
trying to kind of like put me on the spot there and things like that.
And how did that work out for you?
Well, because then I would ask them, right, like, okay, what do you think is best for you? And then they're like, well, I don't know, you're the therapist, right? And so it's like
Throws it back at you.
yeah, so it's kind of like, okay, well then, if let me do my work,
Mm-hmm.
and then if it's not for you, then it's not for you, right? But I think that it's kind of complicated because, like, you think about like borderline, and sometimes I think about it, and I had this one client that was diagnosed in borderline actually when we worked back at El Paso Mental Health, and I think about it now, and it's like that was probably more like histrionic because there was a little bit more
What's the difference?
flair and drama to like the occurrences and in like the stories.
Mm-hmm.
You don't want to, like, you're not there with them, but they sound a little bit embellished, right? And then and you think, well, even if it's like half truth, it's still a lot of bad stuff they went through.
Yeah.
But it's just like it didn't add up.
A lot of comorbidity. Is that what it is?
Yeah.
Yeah.
Yeah. And so
They
like
kind of overlap with one another.
and then conversely, like narcissistic, like I think everyone thinks like, oh, my ex is narcissistic, my whatever.
Pop culture.
Yeah.
That's the thing, Ivan. And that's exactly the reason why we wanted to have this conversation about personality disorders. Because pop culture, TikTok, Instagram, YouTube, whatever, they all seem to know how to diagnose people now. Oh yeah, my ex he's a narcissist, or yeah, she's a psychopath, or he's a psychopath. But we really have to set those. We really have to let people understand and know that personality disorders are a big thing.
Yeah, and I think that without really like being too challenging towards them, right, and be like, well, let me educate you on this, but rather, so what's kept you in the relationship, right? Or what, and I feel like that can be like the lack of accountability, right? It's kind of like, oh sure, like maybe they are narcissistic, but like I can't control what he does, you can't control what he does or she does, right? And so like what can we work on here, right? Because I think that some people do want to like come and vent about like how bad their ex is or their current partner is and things like that.
How do you handle that?
I think that some people, they still need some time to vent, but then I told them, like, if they just don't, give you like a little bit of a narrow pathway to kind of like talk about the important stuff, I do think then it's like, look, we're coming up on 50 minutes. I really want to give you something that's going to like at least help us kind of like, do my job and something that can be helpful for you. And, you try to sprinkle in, I couldn't think off the top of my head of how I phrase it, but it's something along the lines of what can you do, right? Like what's under your control? Because I can't control what they do, right?
Yeah.
So, and that depends on the person, how they take it. No, it's usually okay, but not always.
During a session, have you ever had a situation where it just got so uncomfortable though?
Maybe I feel like maybe when I was more inexperienced. Now I feel like, and I would tell this too, like when we have our meetings, I'd say like I don't look at it like, I don't let it kind of like get to me emotionally. It's more like, oh, here we go, you know what I mean?
Yeah.
And so like they might be kind of like, I'll use that time that they're kind of repeating themselves a little bit to think about like, okay, how can we frame this or reframe this, right? And how can we kind of like make this helpful for us? Because some people will say, I haven't heard it in a while, but they'll say like, well, what do you care about that? Like you get paid either way. It's like, yeah, but I care about what I do.
Absolutely.
Yeah.
I don't think anybody in this field, if they just kind of winged it,
Yeah.
no, I don't think it would work out. You have to be able to have, some empathy and ensure that you're doing the right thing for the client for sure.
Yeah. And that can be hard. I mean, I had a professor that would say kind of like, yeah, if they have they have like this, what's the word? If people tend to not like them, it's going to be really hard for you to like them, right? And it's not about that, right? You have to look at it from the eyes of like I said, empathy, compassion, and all that good stuff, right? And at the very least, look at it kind of like how can I be useful to this person? You know what I mean? And some people, don't get me wrong, I mean, some people do need to vent. They need to vent for a while. But you have to know when it's like, okay, Is this just like we just came here to kind of like talk about what they're doing to me, but then we go back to the same environment, or are we kind of like gonna like deflate that a little bit and then be able to talk?
Yeah,
and that's a lot harder with personality disorders.
What do you think causes personality disorders?
I think it's a lot of trauma. I do think there's a lot of truth to that, right? Because I don't want to come off callous, like as I talked about the embellishment of stories, but I do think they probably went through a lot, especially abandonment or how they perceived it, right? It doesn't necessarily have to be, because we're not playing trauma Olympics, right? They don't have to go through sexual assault and things like that. They can go through a lot of emotional abandonment, things like that. Everyone has different needs, right? I have women that really had a need for a father figure, and men who had a lot of need for a mother figure, right? And so even though they had a solid parent, they had a little bit more of a need for that gender in their life than other people, right? And I think that you can have like identical twins that went through the same traumatic events, but their needs might be different, right? One needed more validation, the other one needed more approval and guidance, and the other one needed more comfort and education.
Yeah,
you know what I mean,
a little more attention. Yeah. So who gets diagnosed more, males or females with BPD?
I don't have because I don't want to, like, that would be my personal opinion.
Yeah.
And so I wouldn't know. I think that one, we probably like do diagnose that like maybe too much, right? Not a lot, but I won't say a lot, but maybe more than we should. But I think it's different, because I think even then, even if someone has BPD similar background to the other person or the next person, it can still look very different. I think with someone, you can still take your time and be like, maybe it is borderline personality disorder or histrionic. And for another person, it's like, oh yeah, I can feel it. Like there's some traits here. You know what I mean?
And then sometimes people have a hard time working with them, or in their own families having a good bonding relationship with them.
Yeah, I had a professor who would say that, like, and maybe it is true. He said, like, between that or an illness like cancer, sometimes cancer any day, right? Because it's so hard, but what it does to your connection with other people, right? Because sometimes they have the disorder and they do have the support, but they have the perception of like, no, you've done this and you betrayed me and everything. So they push people away. Sometimes they have disorder, and on top of that, they don't have people around them, right? So it's almost a self-fulfilling prophecy, or self-fulfilling because like maybe they went through that before they were even diagnosed. So it's different things, different situations, right?
So complex.
Yes.
Wouldn't you say?
Yes.
Yeah. Dr. Gabor Mate, he wrote a book on trauma, and he talked a lot about that. He talked about human connection is what cures trauma. And a lot of times with personality disorders, it's so severe that they push people away and they don't allow for people to come and get close to them because of various reasons. But then they push them away, but then they find a way to bring them back, and then they push them away again, and that's what makes it more difficult.
Yeah, and I would say kind of like with this conversation, I know it's been broad, but because I think that in my perception, everyone goes through some sort of a trauma or attachment issue, and that's what we bring to the table, right? Because even if you had like a good upbringing and it wasn't perfect, right? And a lot of people will come in and say like, no, I don't think this is my issue because my parents were great. And then you find out that, yeah, they were great, but they were gone a lot of time. Or they had like 7 siblings. So the attention was divided a lot. And then, so I don't think it's about fixing what's wrong, because that implies you're broken. I see it more as like, if you went to the doctor and you ran some blood work and you're missing some nutrients here, that also applies to our mental health, right? Like, you maybe just didn't get a little bit of what you needed back then. Because maybe when you needed more guidance and advice or man time, your dad was going through an illness, right? But you can't blame him for that. But you can still recognize that it hurt you, right?
Yeah. And
it's okay if you feel angry, because like you need to feel it and then recognize, well, it's not his fault he got sick.
Yeah.
But some people will think, well, they'll think I'm a monster for hating my dad because he wasn't around because he was sick.
Yeah.
Well, maybe, but like here in therapy, no, because it sounds understandable when you think about it.
Absolutely. Yeah. So there's a whole bunch of stuff that we could talk about when it comes to these personality disorders, because we have cluster B, which has borderline personality disorder, which we spend a lot of time talking about because that's the big one, right? Yeah. And then you had narcissistic personality disorder, and then you had histrionic personality disorder, and then the last one would be antisocial.
Yes.
Right. And that one is categorized by, what's the main thing on that one?
I think that it's a lot of like, there could be a lot of destruction of property, being violent, aggressive, and things like that. And so I would say that, this is what we talked about, like the jail or prison systems, being not managed well, because a lot of people might be dealing with that, right? But no one wants to tolerate that, right? And so, but I feel like that was much more common when I worked with you. I think we had a lot more cases with, the juveniles that were headed in that direction. Or adults too, but I feel like...
Yeah, but with the adults, it's a little different. I mean, I've seen some people with antisocial personality disorder traits that are up in the corporate ladder, that are people that have very important positions in society, right? Also,
I feel like that could be, I don't know, like what if that could be a little bit more like the Netflix thing, right? Where like they can have this facet or part of their lives where they can be, have their tie and suit, but like they're very destructive or self-destructive in other areas of their life because they can afford to hide that part of their lives. And I think that there's some truth to that, not to get to like conspiracy theorists, but like you hear a lot of people getting canceled and things like that, and it's usually because we figure out something about them that we don't like, right? And I think that, speaking on that real quick, I think that we have to kind of like consider that maybe the people that we look up to, they're also human beings, right? Enabled human beings at that.
Yes, right? Flawed.
And so it's easier to kind of like hide or put that away, I think, if you have resources.
Yeah, you're right about that. We can go on forever talking about this, Ivan. Yeah. But last question, because believe it or not, we've already come to the 5-minute mark. What's your approach, your treatment to help people?
Yeah, so I would say like not to make it always the same, but like I mentioned earlier, right? Like I don't think about it and this is why I've been so broad about it. So like, I'm sorry for people who like, well, what is it then? But I always, whoever I bring in, I'm thinking, was this person missing in their life? And how do we get them to implement that? And I like how one of my first clients said, like, don't make me do the corny therapy stuff, right? Which is kind of like, I don't know, look at myself in the mirror, tell myself that I love myself, or do this, or coping skills. So I try to avoid that and talk about it in a more abstract way, where it's like they can tell me, what is it that you wish you had in a perfect version of your life or your father or your mother and things like that. And if they can get there soon enough, I mean, they get there, but like, they'll say like, well, more recognition for these things. I did good in school and they never really bat an eye about that. Or, this happened. And how do you practice that, right? And I tell them, and then when it starts to get into a little bit of the emotional stuff where like, I needed more, someone take me to McDonald's for an ice cream. It's like, okay, do that. It's like, well, no, that's kind of lame. It's like, okay, go to yoga then. I'll sign you up for a yoga class. Okay, no, I'll do the ice cream thing.
Good. Yeah.
And but like I think that you have to consider that. And sorry if it take a little bit of their time, but like I not to look at everyone the same, but look at them. I think it helps all with the compassion aspect, right? So like regardless of the diagnoses, like you can still treat them like, okay, like you're not broken. We're just like plugging in some things in there that are missing that only you and I can do, right? And you'll see a difference in how the mood stabilizes or like your perspective changes and all that. Rather than just saying anger management, you need to take deep breaths and stuff like that, because that's really hard in the moment.
It is. It is. We got CBT and DBT as ways of doing that, right? How do people find you if they need your services?
I'm still at ABTS, and so you can find me there. Yes, you can sign up at abts.us and you can just request me if you're interested in talking with me. If you're out of state, just look up Prevail Mental Health in El Paso, Texas, and then so you can sign up. I work through Sundermine and Headway, so they could do that. we also have the Facebook group for the therapists, the Texas and New Mexico counselors. I changed it.
Make sure you plug us in on that one again.
Yeah, especially because like I had changed the counselors, and I think I had rechanged it last time because massage therapists and other people or physical therapists were, oh, okay, let me join. It's like, oh, sorry, I need to specify.
Yeah, okay.
Because I need to be respectful and mindful of other professions, not just like mental health therapists or psychotherapists. So it's changed to counselors, Texas and New Mexico counselors. And so so I'll mention you guys and then vice versa.
Perfect.
Yeah.
No, for sure.
Yeah.
Thank you so much for being on the show again, Ivan. I know it's so short, but it's so interesting to be able to have these conversations. A lot of people don't have them.
Come back again.
Yeah, for sure. Yeah. We're going to definitely collaborate again, for sure.
Sounds good.
And for you guys watching, we want to thank you again for watching the Love, Health, Prosperity podcast. We want to thank again Ivan Torres, LPC. You could find him on Instagram. We'll go ahead and put all his information at the bottom. Don't forget to click the like button and to follow us on social media sites, especially hitting that subscribe button on YouTube. We'll see you guys next week. Peace.